So today we have a launch and training day around PReCePT, which is a programme designed to improve the uptake of magnesium sulfate in preterm babies, which we know will reduce the incidence of cerebral palsy.
Cerebral palsy has a devastating impact on patients' lives. Children with cerebral palsy experience a lot of pain, they're often learning disabled, they may have seizures, commonly have movement difficulties, and may have communication or even feeding difficulties.
It is very important because there is robust evidence that will make a difference in preventing cerebral palsy for preterm deliveries, which will have financial impact for the whole NHS and healthcare.
In Yorkshire and Humber, because we're such a large region, we've taken an approach where we will have smaller events to try and get people together from trusts that may be close to each other, next door to each other, so they can network and share with each other.
The Academic Health Sciences Network has put this event on for us, and we're really grateful for that, because quite often we are given a piece of guidance or policy to implement, but we don't get any additional time or resource to do that. So this programme allows us to create posts for midwives to work specifically just on PReCePT and to improve their staff training.
The group have been very engaged from the start. They were asking questions, they're bringing things to the table that they're unclear about. It's generated discussion between organisations and discussion generally in the group so far, so we're very encouraged.
We've had midwives, obstetricians and others from around the patch who've come to join with us, and it's been really exciting. There's been a real sense of buzz in the air. Some people have brought anxieties to the floor and shared those with us. Other people have been spotting solutions in those challenges.
These sorts of events, I think, are really key in getting people to share their experiences and what some of the barriers they've faced, and be open and honest about some of the challenges they're going to face and how we can help them overcome those barriers.
Yeah, that networking, that collaboration is very important, because although each individual trust is responsible for how they implement a national programme or a research programme, it is quite handy to know what other work is going, so you can learn from their pitfalls, from the things that they've done well. So that way it should hope for a smoother integration.
I'm going to take away from today a much better understanding of PReCePT and what it is actually about, and also the fact that I'll be able to network with other people from the organisations close to us, so that we can share that learning and know who to go to if there is anything that we want to ask some advice on.
I hope that the PReCePT programme will strengthen the existing work in this area, will quite quickly, I hope, increase the proportion of babies who are magnesium exposed, and that in a few years' time we'll be able to show that we've made a palpable impact on cerebral palsy.